How do you collect a stool sample for an ulcer test accurate? If you're getting tested for a stomach infection like Helicobacter pylori that can cause ulcers, collecting the stool sample properly is key. It helps your doctor get reliable results. First, gather all the materials your healthcare provider gives you. Usually this includes a sterile container, a small spoon or spatula, and clear instructions. Before you start, wash your hands thoroughly with soap and water to prevent contamination. If you need to urinate, do so before collecting the stool to avoid mixing urine with the sample. Next, place a clean collection device over the toilet seat. You can use a shallow pan, a plastic bag, or plastic wrap. This catches the stool without it touching the toilet water, which could dilute or contaminate the sample. Have a bowel movement as usual, making sure the stool lands on the collection device. Using the provided spoon or spatula, take a small amount of stool, usually about the size of a walnut, and transfer it into the sterile container. Be careful not to touch the inside of the container or the lid with your hands. If your container has a liquid preservative, transfer the stool into it without spilling or touching the liquid. If there's no preservative, just place the stool inside and screw the lid on tightly. Some containers might requiring gentle shaking to mix the stool with the preservative. Label the container with your full name, date of birth, and the date and time of collection using a waterproof marker. Accurate labeling ensures your sample is correctly identified. Depending on your test, you might need to store the sample in the refrigerator until you can return it to your healthcare provider. Try to deliver the sample as soon as possible, ideally within 24 hours, to keep it fresh and accurate. Always follow any specific instructions your healthcare provider gives you, as different tests may have particular requirements. By following these steps carefully, you help ensure your stool sample is collected correctly. This accuracy is essential for reliable testing of Helicobacter pylori, which can be linked to ulcers. Remember, if you have any doubts or questions, always consult your healthcare professional for guidance. Proper collection helps your doctor make the best diagnosis and plan the right treatment for you.